Hello, dear friends. Good evening. Welcome to another session of Doctor's Diary. So, today, my topic for today is how accurate are home pregnancy tests. First of all, this is a question which comes to the mind of most of my patients. Are doctor, can we do a pregnancy test at home and will it actually be accurate? How soon is a home pregnancy test to be done? First of all, let me tell you what is a basic, I would say, basis of doing a home pregnancy test. What exactly is it checking? A home pregnancy test is a test which is present over the counter. It checks the hormones which are present in the urine of a lady who is pregnant, and this hormone is detected with the help of a strip, which is the basis of a urine pregnancy test, which the patient would be doing. Now, some patients come to me before they have actually, when they are trying for the pregnancy, they are very anxious and they tell me that doctor, we have done the pregnancy test because I am getting all symptoms of pregnancy. When I asked them as to when they had had their last period, and so they would probably tell me it was they have not yet missed their period. So, is it right for them to do a pregnancy test with symptoms like nausea or any kind of a headache or symptoms of excessive tiredness? See, now a urine pregnancy test would be checking the hormones of the pregnancy at a level which has to be present at least 25 international units is the level at which most home urine pregnancy tests would be coming positive. So, in case you are doing, and this is a level which comes positive at least 1 to 2 days after the period is missed. So, in case you are doing a home pregnancy test, urine test, before you have actually missed your period, you are bound to miss it or falsely be kind of, have false, I would say negative pregnancy test. So what is the correct time of doing a home pregnancy urine test? The correct time of doing a home pregnancy urine test is at least 2 days after the missed period, and before that the pregnancy test would usually not come positive. How is the test to be done? The test is ideally to be done with a concentrated urine sample. So usually I recommend a first urine sample as the best sample of doing a home pregnancy test. I tell the patients that you can do this test first thing in the morning because the urine is concentrated. And how is it to be done? There are two ways. One is a dipstick method in which you would be collecting the urine in a bottle, in a container, and you would be dipping the strip into it. The second would be the most common, which is present in India, is a test in which there is a small well which is made into which 2 to 3 drops of urine are added, and the pregnancy test comes positive or negative as per the migration of the urine sample on this strip. So, this is the best, this is the way in which a urine pregnancy test is done. Now, many patients ask me, doctor, when in case I have irregular menses, then when do I do a home pregnancy test? In case you have irregular cycles, mostly, most patients do have an idea that the period is probably a week ahead or a week late, and they start getting symptoms like breast tenderness, excessive fatigue, excessive nausea, and that is the time when a home pregnancy urine test would be coming out positive. As compared to a urine test, a blood test for the pregnancy would be more accurate. The blood test again detects the same hormone which a urine test detects, but the blood test usually comes out positive a week earlier because this is a very sensitive test. As soon as implantation occurs after pregnancy happens, implantation means that the fertilized egg has implanted in the uterus, it starts releasing the hormones of pregnancy, and after it starts releasing the hormones of pregnancy, the spike which comes in the level of this pregnancy hormone in the blood is what makes this blood test comes positive, even though the urine test would be negative at that point of time. Now, so which is more accurate, a blood test or a urine test? See, friends, in a pregnancy in which the period is not yet missed, and in case you are very anxious, a blood test, of course, would be more accurate. A urine test would be accurate, like I said, after 1 or 2 days after the period has been missed. And what is a falsely negative urine pregnancy test? A falsely negative urine pregnancy test means that you are pregnant, but it is not being detected in the urine test. Now, when is it that the test is not coming in the strip, but you are actually pregnant? Either the strip is faulty, or else the urine level is the hormone level is too low, and you have not read the kit properly, or else you have not followed the instructions which have been mentioned on the kit. So that is a time when the urine pregnancy tells you that it is falsely negative, though you are actually pregnant. What is a falsely positive test? A falsely positive test usually comes in case you have been on certain kind of injections or fertility inducing drugs. At that point of time, the urine pregnancy test comes out to be falsely positive, and because the hormone of the pregnancy is present in the blood, because of the fertility injections and the medicines which you have taken, and because of this, the test, though you are not pregnant, the test would come out positive on the strip. Again, there is something also called a biochemical pregnancy. In a biochemical pregnancy, the test first comes out positive because the pregnancy has happened, though it has not implanted properly, and suddenly the hormone level starts to fall, because of which the symptoms of pregnancy suddenly vanish, and the beta HCG or the urine test turns out to be negative. So many patients might even end up having a biochemical pregnancy, which is present in 20 to 30% of patients, because of which the urine test first is positive, then it turns out to be negative. So, dear friends, a urine pregnancy test, a home pregnancy test, once it is done accurately and at the proper time with proper instructions, is something which is quite reliable and one can go in for it. Also, it's very important to show your strip to your doctor. I tell my patients to read the sample correctly, and come after the time which is specified on the kit, and then come to me with their test. After that, a blood test may not be required unless, of course, I am in some kind of a doubt about the urine test. So, all of you who are very anxious about the pregnancy and want to know whether can't wait to actually visit your doctor's clinic to detect whether pregnancy has happened or not, or who are very apprehensive about giving a blood test, can go in for a urine pregnancy test. So, this brings me to the end of today's session. I'm open to any questions which any of you would like to ask. Okay, now. Okay, so after how many days of intercourse, pregnancy can be confirmed by the urine test? Now, Sanjana wants to know that in case, see, usually after ovulation has happened, after 2 weeks after ovulation has happened, a urine pregnancy test would come out to be positive. A blood test would come out to be positive much before that. So it is just what happens is the egg being released or ovulation happening is the correct time to note down, and this usually happens 14 days before the period starts. So please count your date of ovulation. This is what a fertile period corresponds to, and the urine pregnancy test is done exactly 2 weeks after the ovulation period. Okay, now another question comes from Damini. Damini wants to know that she used to test, she had tried to test 2 times when she missed her period, but overcame the result. Every time the test came out negative, but when she reached out to the doctor, then the results were positive. What can be the reason behind it? Now, Damini, the most important reason behind it was probably you have not done the test properly, you have not followed the instructions which were written on the kit, or maybe your kit was faulty, or maybe you have read it in a hurry when the test was still to be found out, and because of that, the test came out to be negative initially, but actually it was positive. This is what is called a falsely negative test. The next question comes from Rajni. Can she take pregnancy test during the day in the afternoon? Yes, Rajni, you can take a pregnancy test during the day in the afternoon, but of course, for some, if the level of the hormone is quite high, that is, in case it's been a week since you missed your period, the test will come out to be positive, whatever time of the day you might be giving a sample. In case you are giving your sample before that, then the test would definitely come out to be negative. So you can give it in the afternoon too, but that has to happen a few days after you have missed your period. A concentrated first urine sample is recommended just 1 to 2 days after the missed period when you are doing it for the first time. The next question comes from Anukriti. Okay, now she got to know about the pregnancy test being positive a week ago. She wants to know what prenatal vitamins she needs to take. See, Anupriti, the prenatal vitamin which you need to take is folic acid. This is required for the healthy growth of the nervous system of the baby. And hmm, this is a vitamin which is to be taken. Also, please do consult your doctor who would find out whether you are having any other problems like other deficiencies. But folic acid is the most important prenatal vitamin which you should start rather before you have even conceived or once you are trying to get pregnant. The next question comes from Samreen. She says that her bhabi got pregnant a week ago, and she wants to know how she can safely stay active during her pregnancy. See, I would tell all my patients pregnancy is not an illness. You are not sick. Pregnancy bimari nahi hai. So please take your pregnancy in a very healthy, in a very positive way. Remain fit. You can do all the exercises, which of course you were doing prior to pregnancy. What I mean to say is, I don't expect you to be doing any kind of vigorous activity or very, heavy exercises, but definitely you can go for a walk every day. You can swim. Women have also been running marathons during pregnancy, but of course, I would not be recommending that. It's important to go out for a walk for at least 40-45 minutes every day. You can do simple yoga, and it's my baby app, which is a Cloud9 app. All exercises which one can safely do in pregnancy, which are also called the prenatal exercises, are recommended. You can also come over to Cloud9 Sector 14, where our physiotherapist would tell you about the exercises which you can do during your pregnancy to remain fit. So, but of course, heavy exercises, lifting weights, and all are definitely not recommended. Now, Rajni wants to know why you have to wait for 3 minutes for a pregnancy test. See, you have to wait for 3 minutes for a pregnancy test because it takes time for the hormone, the urine sample to migrate up the strip. Once the urine sample, the hormone migrates in the strip, only then it would react and it would come out positive in the C line, which is a control line, the test line, sorry, it would come out positive in the test line. So that is the minimum time which is required for the urine sample to migrate up, because of which you have to wait for at least 3 minutes for a urine pregnancy test to come either positive or negative, to read the test. The next question comes from Rupika. She wants to know what is the reason of getting a false pregnancy test result. She missed her period from last a month, and then she used Prega pregnancy test, but she found it to be negative. When she visited the doctor, the test was positive. How is it possible? See, either you have not done the test properly, or the kit was probably a spoiled kit. Because of which, it's not that one brand is better than the other. It is just that you have probably not read the kit properly, or maybe you have done it a little early. That is the reason, even though the test was positive, it turned out to be falsely negative. So this is what I'm saying. Please read the instructions on the kit properly. If you will wait for at least 3 minutes, like the first patient has asked me, you will be able to read the kit. Also make sure that you are taking a concentrated sample and you are doing it at the correct time. By the correct time, I mean it should be at least 2 to 3 days after the period has been missed, not before that. Any other questions? Okay, thank you so much for joining me. If in case you have any queries, you can always visit me at Cloud9 Sector 14. I would be more than happy to answer all your questions. Have a good day.